Hello, I am Dr. Biplab Choudhury. I am a consultant gynecologist and I am here today to discuss about polycystic ovarian disease. Why is it important to know about PCOS? About 1 in 8 lady of the reproductive age group suffers from PCOS, and this has got long-term implications as these women in the longer term will suffer from either diabetes or infertility or dyslipidemia leading to heart ailments in future. So it is very important to know about your polycystic ovarian syndrome. PCOS has got huge psychological impact. It creates lower self-esteem among young girls, negative self-image, gives depression and also psychological distress. How do you conquer it? You conquer it by leading a very active lifestyle and looking after your diet well and help to improve your mental health by knowing your disease. Everything in this world is possible, but when you have the right information and knowledge at the right time and right place. So this is perhaps the right time and place to know about your PCOS. So what we learn today is 1. Female reproductive system, normal menstrual cycle, phases in menstrual cycle, what is PCOS, what are the signs and symptoms of PCOS, diets to be added in PCOS, foods to be avoided in this disease, and management of PCOS, different methods which can be easily worked out at home. And there could be some question answers at the end of the session. What is female reproductive system? It consists of uterus, the tubes, the ovaries, the cervix and the vagina, and the cycle consists of menstrual cycle, which is the 1 to 5 days of periods, and thereafter the follicular phase of the cycle, which will be up to the 13th day, and on the 14th day you will have ovulation, and from 15 to 28 days you will have the luteal phase, where the cycle ends at the 28th day. This is a normal menstrual cycle. What is polycystic ovarian syndrome? Polycystic ovarian syndrome is a hormonal disorder. It causes irregular menstrual periods. It causes excessive amount of testosterone in blood, and the name polycystic ovarian syndrome suggests there will be tiny cysts in the ovaries, which are fluid-filled structures that is contained in the ovary. It's time to clear our confusion about PCOS. PCOS signs and symptoms may vary from women to women. Women with PCOS may not have any signs of symptoms at all. Our whole objective of this lecture is to know the subtle signs of PCOS so that in future we are ready to face any challenge from our day-to-day activities. What are the signs and symptoms of PCOS? It is irregular or absent menstrual cycles. The menstrual period, as I have said, is around 28 days, and if it is irregular, the gap between the periods keep on changing. The periods may come early or they may be late, but this should not be in all cases or routinely. Periods may come within 2 or 3 months also. There could be excessive hair growth, as in hirsutism, which is in the face, also in the hands, in the back, and also in the chest. There could be acne, which induce in the skin glands to create an excessive amount of sebum, an oily material which develops, and severe acne, and it usually does not respond to treatment. There is thinning or loss of hair. I'm sure a lot of people will have this sort of hair loss. PCOS can contribute to the hair loss. It is associated with higher than normal levels of testosterone, which affects the hair growth and often complains of hair loss around the temples and the frontal regions. There could be dark and thick skin, neck, arm, and thighs. The skin folds may become dark and thick. In medical terminology, we call it acanthosis nigricans. Acanthosis nigricans typically occurs in people who are obese and are pre-diabetic. There could be skin tags, which may be associated with high LH, which is a hormone. It may be there in obese conditions, and you have to contact your dermatologist to remove the skin tags. And of course, there is weight gain. PCOS make it more difficult for the body to use the hormone insulin, which normally helps to convert sugar and starches from food to energy. This condition is called insulin resistance and can cause insulin and sugar levels to rise in the bloodstream. High levels of insulin will produce male type of hormones and also impact the lipid metabolism of the lady. It also leads to weight gain, and there is increased amount of belly fat, and the waist hip circumferences are also altered. There could be anxiety and depression with PCOS because of the body changes, and also there is weight gain, acne, and excessive hair growth. Insulin resistance is also associated with depression. There could be elevated blood pressure. The normal is around 120 to 80, as you all know, but there could be raised blood pressure, and this is mainly observed in obese patients because of increase in cholesterol and low density lipoproteins, which are increased usually in metabolic syndrome of PCOS. Diagnosis of PCOS: because of the irregularity of periods and the high testosterone levels, which causes acne, hirsutism as we call, and also cysts in the ovaries when we do an ultrasound scan. What are the complications of PCOS? Depression, anxiety, and eating disorders are an important complication. Abnormal uterine bleeding, delayed periods, type 2 diabetes mellitus in the long term, increased cholesterol leading to dyslipidemia in the long term, and infertility in the long term.